slide. So as Steve said, I'm going to be talking about, often these webinars are looking back in time, lessons learned from the past. In a way, this one is, but it's how we have learned lessons from the past as we move forward with a new initiative to support evidence-informed policymaking about the non-health SDGs. We were going to talk about it in very general terms, but I'm delighted that about 33 minutes before the webinar launched, the funding was officially confirmed. So we're thrilled to say that we're going to be launching PEARLS, which stands for Partners for Evidence-Driven Rapid Learning in Social Systems, with funding support from Canada's International Development Research Centre, and they're able to support this through a partnership between Canada's IDRC and the Hewlett Foundation in the United States. So we're thrilled that we're off to the races with this new initiative, which will formally start on the 1st of December, so this coming Saturday. So PEARLS currently has 14 partners. We hope as the years go forward, we'll have additional partners joining us. But for this 3-year initial project, we have 6 partners in Africa. You'll see the 6 countries listed here. And we have Laurenz joining us from one of the 6 African partners, South Africa. We have 5 non-African teams, 3 of which are in Latin America, and we have Cristián Mansilla A joining us from Chile. And then we have 3 what we originally called peer support teams, but as a set of partners agreed that perhaps far better language was synergy support teams. So all of the partners involved in this initiative bring tremendously rich experiences to the table. And we wanted to come up with language that clearly indicated that people were all learning from one another. So the synergy support teams are just trying to facilitate that learning process. And I'm representing them from Canada, but we also have partners in Lebanon and the United Kingdom. So we have 10 lessons that we built into the new initiative. The first 4 of them are about adapting, piloting, and iteratively refining 4 categories of mechanisms to support evidence-informed policymaking. So in the Learn How category, I'm going to be talking about our planned work on workshops for policymakers and citizens. Within Find Evidence, this is the only time that I'll have 2 slides, one about our social systems evidence alerts that will bring new evidence to the attention of policymakers and stakeholders, and separately our plan for rapid syntheses to respond to their requests. In the Spark Insights category, while at the forum and among some of our partners, citizen panels and stakeholder dialogues can sometimes be done separately from one another. As part of PEARLS, we're going to treat them as a combination with a citizen panel preceding and feeding into a stakeholder dialogue. So I'm going to talk about them together. In the Embed Supports category, which is where we try to institutionalize the use of evidence in policymaking, I'll mention checklists as one concrete example of several of the institutionalization mechanisms that we're going to be using. So 4 messages about mechanisms, which I'll come to. 3 are about types of support. And these operate at different levels. So first, strengthening the capacity of each of our organizations, each of the partner organizations, strengthening their institutional capacity, which can mean things like developing sustainable funding streams that will allow them to move forward over long periods of time, producing high quality outputs. Second, joining up the national ecosystem of policy supporting organizations. So our partners, just like with the forum here in Canada, are part of a complex ecosystem, and we think that to answer the very complex questions coming from policymakers, we need all of the different groups playing to their comparative advantages, but working collaboratively. And then third, contribute to an international community of practice so we can learn from one another about what's working and what's not working and how we can improve it. And the final 3 messages have to do with an enabling set of structures and processes. So we'll talk about how we've chosen to create what we're calling an opportunity fund that can be accessed when windows of opportunity open. And we'll talk about our approach to shared leadership and building in structured lesson drawing from the beginning. So those are the 10 lessons, 1 slide for each, with the exception, as I mentioned, of line 2, where I'll be talking about them separately. So first, the Learn How. These are the workshops for policymakers and citizens. And here we think it's important that people have, with various degrees of sophistication, an ability to do systems analysis, to understand how social systems work now and available alternatives, both overall and in particular areas. They also need to be able to do or understand policy analysis, to work through how problems and their causes can be understood, how policy and program options can be framed, and how implementation considerations can be worked through. And lastly, if we're going to have traction in policy environments, we have to also be able to understand the political context. And that means understanding the factors influencing government agenda setting and policy development. And then there are two complementary types of methods that we think are very important. One is in the area of evidence synthesis. We're going to be focusing on three approaches to evidence synthesis: rapid syntheses, citizen briefs, and evidence briefs, and then also stakeholder engagement. And we'll talk about two in particular: citizen panels and stakeholder dialogues, but we're also going to now be adding stakeholder engagement to our rapid synthesis process that some of us have been doing for some time, but only recently started to do interviews and so on as part of that. So find evidence. So this is the one area where we have two lessons that we've built into our work. So the first of the two is social systems evidence alerts. So here what we're going to make possible are customizable monthly email alerts that provide links to evidence briefs, quality rated systematic reviews, and economic evaluations about most of the SDGs. So on our official start date, we will not be covering roughly half of SDG 7 or the 3 environmental SDGs, 13 through 15, but we just yesterday had final sign off on a partnership with the Monash Sustainable Development Institute that will see them starting in the new year adding environmental content to social systems evidence. So not too far into 2019, we'll be able to provide these customizable monthly email alerts across all of the non-health SDGs. And now if I move into the rapid syntheses, so this is where we respond to policymakers' questions on very short timelines. So we're currently planning as part of PEARLS to offer 3 timelines, 3, 10, or 30 business days. And we'll respond with demand-driven rapid syntheses of best evidence, which many of the partners have direct experience with providing, but we hope also, where appropriate, to supplement that best evidence with what we're calling jurisdictional scans that identify who's doing what and why. So very often politicians and public servants don't just want to know the evidence, they also want to get a feel for what other similar countries are doing and why. We'll also be, where appropriate, conducting key informant interviews to capture the tacit and experiential knowledge that are so key to making change happen. So that is part of the stakeholder engagement. So that's the rapid synthesis part of PEARLS. Now, if we move on to the Spark Insights piece, this is where we come to the combination of the citizen panel and the stakeholder dialogue. So the citizen panel is a co-designed process with a steering committee that guides the work. The panel itself is informed by a pre-circulated plain language citizen brief, and the panel gives a diverse group of citizens an evidence-informed voice in what gets decided. And what we're particularly interested in are the values that are elicited through the citizen panel that citizens believe should guide policymaking on the issue. We'll also have steering committee supported policy dialogues informed by an evidence brief, and that brief will, as many of the partners have done in the past, include best evidence. But given that we'll now have a panel that precedes the dialogue, we'll also be able to weave into the evidence brief the values that citizens believe should guide decision making. And then the dialogue itself will give civil society organization representatives, frontline service providers, district managers, high-level policymakers, and others an evidence-informed voice in what gets decided. And very critically, it's not just the evidence that's on the table during the dialogue, it's all of the factors that are going to drive decision making. So the dialogue provides a very unique opportunity to couple what politicians really need, which is a compelling problem, a viable policy, and conducive politics if they're going to take action. If I now move on to lesson 4 that we built into our plan for Pearls, this is where we work through options to institutionalize support for evidence-informed policymaking. And the example I'll give here is a research evidence checklist that we hope to encourage our government partners to require be completed before, for example, any briefing of a minister or cabinet. And the current version of the checklist that we'll be adapting in partnership with Pearls asks 3 questions. The first one, the open-ended, how is research evidence used to describe what's known about a problem and its causes, options to address it, and or key implementation considerations, depending on what the briefing is focusing on. Secondly, which databases were searched? So social systems evidence, for example, if one's interested in systematic reviews. Alternatively, or one would hope additionally, a database of local studies to identify what has been found locally. And the third question is, what types of research evidence were found? So for example, a high quality systematic review and 3 local studies. So those second and third questions, at least in the current version of the checklist, are tick boxes, whereas the first is an open-ended question meant to prompt reflection and provide some level of accountability that people have tried to find evidence to inform what they're saying. So those were 4 lessons about mechanisms. Our next 3 lessons are about some of the supports that go alongside those mechanisms to better provide better responses in any of those areas. So the first is strengthen the capacity of each of our partner organizations, and this involves 3 steps. First, an organizational assessment that will be led by Canada's IDRC with prompts about 9 potential areas of focus that the partners that have identified as being the types of areas where many of us typically need to develop institutional capacity. Then coming out of that assessment, a cohort of teams, not all partners, but a cohort of teams will work with an external consultant and with the Synergy support team to tackle areas of shared interest. So they'll each be building their own institution's capacity, but they'll be going through that institutional capacity strengthening experience alongside other partners that share similar goals. And the final step will be periodic reporting on progress. If I now move to lesson 6, so this is joining up the national ecosystems of policy supporting organizations. So organizations like EVIPNet, which inspired much of what Pearls is planning, is in the second to last row. It can work through problems, options, implementation considerations, might have a tendency to focus more on how a variety of programs and services and so on are organized to get to the people who need them. But there are many other groups in countries that can provide tremendous value to the policymaking process. And if a question comes in to tackle a particular issue, where we really need expertise from people doing technology assessments or guidelines or have tremendous experience in monitoring and evaluation, the hope is that over time we would involve them in these responses, but also to take steps generally to join up these national evidence ecosystems so that people are working together and each playing to their comparative advantage in ways that provide as comprehensive a response to policymaker questions as possible. The 7th lesson, and the final one of the support-related lessons, is contribute to an international community of practice. So we very often find ourselves learning from our partners. In fact, the McMaster Health Forum has modeled much of its work on the experiences of our partners, who we watch very carefully and build on their experiences. But this is probably the first time that we have, from the very beginning of a new initiative, explicitly planned for learning across the partners. So we have, over the 3-year life of the project, 3 face-to-face lesson drawing workshops planned. We will have at least quarterly WebEx meetings between each team and their Synergy support team partner. And we'll also have monthly WebEx meetings with all partners, which, now that we know that we have the go-ahead on the funding side, will be starting in December. The 8th lesson learned, and now we're getting into the area of the structures and processes that can support this work. So one of the key innovations that we're very excited about is what we're calling the Opportunity Fund. Very often, grants to groups provide earmarked funds that are available for them to use over the life of the grant, without any connection to whether or not there are windows of opportunity that could increase the prospects for whatever they do having a big impact. So with Pearls, what we're trying to do is turn this around. While a small amount of core funds will go to each of the partners, the bulk of the funds are sitting in an opportunity fund that can be accessed when a window of opportunity opens. So if our colleague Cristián, who's on the line, gets a request from government to do something in a particular area, it has to be done in 2 weeks, and they know a decision is going to be made. He can immediately fill out a very, very simple form that would just take a few minutes, submit it, and within 24 hours be given approval to proceed with the rapid synthesis, for example. So this will allow people to prepare rapid syntheses, the combination of a panel and a dialogue, and a push to embed supports in government. So there are times where, for example, a government may not be that interested in institutionalizing the use of evidence. But when windows of opportunity open, we want people also to be able to move quickly to respond to that opportunity. So the Opportunity Fund will support 22 rapid syntheses, 8 panel and dialogue pairs, and the briefs that inform them, and 6 of these efforts to institutionalize evidence use. The 9th lesson learned, which has been very helpful and arose from a proposal finalization workshop, is the idea of shared leadership. And so we've now created what we call a partners executive group with leadership from each region. And that group will make decisions on behalf of the partners when time-sensitive decisions need to be made. And given that many of the partners are very busy people, often their days taken up with responding to requests from policymakers and others, we've instituted a mechanism with WhatsApp that will allow us to quickly alert the partners executive group that we need to make a decision within 24 hours on an opportunity fund application, so that they can quickly check their emails, review it, and then we can proceed with the decision. And if one or more of them aren't available in that window of time, then we would proceed with the few that are available. So it's meant to be a very responsive process, but also to give voice to a variety of different partners in that process. The final piece, which builds on the community of practice comments that I mentioned before, is build-in structured lesson drawing from the beginning. So we already have outlines of 5 reports. They will iteratively evolve over the life of the project. There's one for each of the 4 categories of mechanisms. Learn how, find evidence, spark insights, and embed supports. And then there's one for the combination of the 3 types of support. So building the institutional capacity at the organizational level, joining up the national ecosystem, and participating in an international community of practice. And while we develop those reports, we'll be paying particular attention to whether the approach taken, the findings that come out of the work, or the influence of the findings varies according to context or issues. So do we find that countries that have a particular type of political system, certain types of decision-making processes, or certain types of issues are more or less receptive to certain of these mechanisms? The other thing that's being planned to be led by IDRC and a consultant that it brings in is an independent developmental evaluation that will allow us to look at some issues that we as people who are actively engaged in this process might not be well positioned to look at. And that includes questions like, how do people in other sectors respond when people who have come from more of a health background start to do work in a broader space? So we certainly have partners like the Africa Center for Evidence that have worked for a long time in the broader SDG space, but in some of the countries, people are moving from more of a health background into a broader SDG space. So if I just conclude with the lessons learned, 10 of them, as I mentioned, 4 of them have to do with the mechanisms that we have built into where we're going with this new initiative. 3 of them have to do with the supports that we think will allow these mechanisms to have even greater impact. And 3 of them have to do with innovations on the structure and process side that we think will allow us to be very dynamic. In the case of the Opportunity Fund, that will have a distributed leadership model that gives many different partners voices in key decisions, and that will build in that structured lesson drawing from the very beginning so that we're very consciously learning from this exciting new initiative. So those are my top 10 lessons learned. I'll just pass it back to Steve to take us through the commentaries.
Great. Thanks very much, John. Appreciate that. That was really some very interesting insights and a great overview of the Pearls Initiative. We'll just actually skip right to Cristián, who will share some of his insights, and then Laurenz will follow up from that, and then Marie-Gloriose can follow up and provide some insights from IDRC. So Cristián?
So I will try to do probably my best on this to describe the benefits and challenges I foresee now on the implementation of this project. So let me elaborate a couple of points that I believe will be important to mention regarding the implementation of Pearls. First, during the next couple of months, the government here will work with UNDP to put on paper a strategy that they will kind of elaborate to implement the SDGs. And this could be an important opportunity for Pearls for this project and to us as a unit to inform with evidence the planification of strategy. And we already are talking with the SDG Secretariat in Chile for this process. And I think that's an outstanding opportunity for this project as well. Second, also, we are currently facing a new process to build a national health strategy for the next decade, 2020-2029. This process will have the collaboration of our units for the multisectoral agenda to reach the strategic objectives of the decade by using an evidence-informed approach. And this project could also be an opportunity for Chile to conduct a complete and comprehensive policy analysis on country ecosystem, and this is related to some country ecosystem. And when mapping the different actors' health policies interactive, the non-health sector will certainly be part of the picture. And I think the contribution of Pearls of this point could be providing methods to shape the complete landscape of the different actors and variables that will affect policy. We'll just continue with the third point that I have here. This is something related to what John mentioned in his 7th point on the international community of practice, that we are really eager to learn from each other of part of this project on the different experiences that we will face during the project. I think this will be an outstanding opportunity to share strategies on how to better inform policymakers by scientific evidence. And these 4 points I just selected because I think they have a relevance to our ecosystem here, evidence ecosystem in Chile. But I think the greatest contribution of this project is something beyond these 4 points, and it's related to the reshape of what we understood so far by multisectoral action. So I just would like to spend a few seconds to talk about multisectoral actions in Chile and to show you this is how multisectoral action looks like now in Chile. We have the president, right, at the top of this graph. Then several ministries behind. We have, for example, labor, education, health, environment, social development, and many more. And each ministry will design and implement several policies with a variety of scope. In some cases, we'll see collaboration between ministries, but frequently this is not necessarily the case. So now I would like to show you how multisectoral actions will actually look like after the implementation of Pearl. So as I say, Pearl will help to reshape the coordination between different sectors by introducing a common language. And this common language will be the evidence to inform the policymaking decisions. And this common language will help us then to have a picture of evidence in every policy that will be designed and implemented by every institution. So as you see in this, the evidence will kind of or address many issues related to several policies across different ministries, different sectors. Also, this common language will help us to have a fluid talk with the civil society, universities and academia, people managing the public budget, like the Ministry of Finance, the Parliament, NGOs, and international organizations, and many other stakeholders that the country ecosystem includes. And finally, and this is also related to John's 4 key messages that he described on embed support, I think the greatest contribution of this project could be also to have people working at each one of the institutions of the multi-sector to coordinate and generate evidence-informed effort to produce these evidence-informed policies as well. So basically, this will, in my brief, just few minutes to describe, I think I have like 3 or 4 points that are probably the main contribution of PERS in Chile, but I think this could be the greatest contribution to reshape how we think and how multi-sectoral action will look like in Chile. And this is the picture that I see as a long-term goal after the implementation of this project. We'll look forward to work together as a real partnership with country teams and synergy support teams. And we are very, very happy to be part of this initiative. So thank you.
All right, Laurenz, I've made you the presenter now, so if you want to walk through your slides as well, that'd be great.
Super, thank you. Can you hear me okay?
Yes, perfect, thanks.
Brilliant. Good evening from Johannesburg. It's a pleasure to join this lovely webinar on how PEARLs can help us implement evidence-informed policymaking, EIPM, here in South Africa. We'll have just a brief 5-minute reflections from our side and in 3 slides. So the first one will give you a little bit of context on EIPM here in South Africa, and then I'll reflect a little bit on what we hope PEARLs can achieve in the short term, and then to give you a little bit of an outlook of how ideally we'd want to see changes in the EIPM landscape in the long term. Okay, so just to give a little bit of context to see where this initiative is coming in here in South Africa, because I think it shapes how we see the short-term and long-term changes that we ideally want to observe. So we have quite a nice institutional environment for EIPM, and in a sense where we have a national department that coordinates the use of evidence across different government departments, and that's the National Department for Planning, Monitoring, and Evaluation. And so throughout this brain for EIPM work in South Africa, which is this department, we call this a coordination of government's work according to 14 key socioeconomic outcomes, which are laid out in our national development plans. So in a sense, the departments are currently required to use evidence in planning, implementing, and assessing programs against these particular socioeconomic key priority outcomes. So which gives us quite a healthy space for evidence use, in which there's a department that coordinates the space, and there's kind of a pull mechanism for the other government departments who implement social policies and programs to use this type of evidence. And within this institutional setup for EIPM, we have, from a historical perspective, we had quite a few initiatives that has focused on EIPM capacity building over the last couple of years, in particular on a senior decision maker, policy maker level. And these EIPM capacity building initiatives have been largely on technical skills, for example, on critical appraisal, finding evidence, integrating it into decision making. So that kind of reinforces this institutional space for evidence use with the adequate skills that further contributes this demand for and pull of evidence from a national government perspective. To say there was a slight caveat that most of this EIPM work comes out of the health sector. So the institutionalization is furthest advanced in the institutions that work across the healthcare system, and less so in the social system, in particular around labor and economy, crime prevention, etc. And which is quite interesting because we have the system where this evidence infrastructure is quite strongly established and decision makers asking for evidence, but we have a challenge in commissioning and producing policy relevant evidence synthesis for these government departments. So we had quite a few instances where government departments wanted to commission evidence synthesis and didn't find the adequate supply from the research sector to produce these. And then I think the last important contextual factor to mention for PEARLS is that South Africa has a very vibrant civil society. So historically speaking, for example, the Treatment Action Campaign, there has been quite a big push from civil society for certain policy issues to be on the agenda, to use evidence to inform these. There's kind of this context in which PEARLS is being introduced in this EIPM space in South Africa. So what then do we hope in the short term something like PEARLS can contribute? So the first big point really for us is that we hope PEARLS will help us meet government demand for rapid and policy relevant evidence synthesis. So there is demand currently, it's not being adequately met. PEARLS brings a new initiative with fresh ideas and fresh support for these rapid evidence syntheses, different types of rapid evidence syntheses. The second contribution we hope is that we also have a bit of a renewed buzz around evidence use in social systems in South Africa. So there's been a bit of a community of practice around this, but PEARLS brings a new push, new ideas to strengthen and enhance these networks of organizations that work in this space. And in particular, it's a bit that there's a couple of government departments that have driven this work in particular. PEARLS ideally will allow us to broaden this range of government actors to go into different departments to make the case for use rapid syntheses within social systems. The third point would be around creating appetite and demand for the use of evidence outside the usual suspects in particular. So PEARLS brings a slightly different angles with methodologies around rapid learning, the SDGs, political analysis, and systems change. So these type of organizations currently are not necessarily well integrated within the evidence ecosystem here in South Africa. So PEARLS will, in the short term, hopefully allow us to bring these organizations stronger within the community. And likewise, to extend this work to civil society actors, such as NGOs, the media, which again, currently are probably not fully integrated. The fourth contribution in the short term we hope PEARLS can make is to allow us to implement new approaches for EIPM that haven't been tried, in particular in social systems. So the citizens dialogues, the stakeholder dialogues, these are all new and exciting mechanisms for us to try out that haven't been established in South Africa before. And in reverse, also for us to kind of develop and share slightly more some of the mechanisms we have developed here in South Africa around evidence mapping, matchmaking between decision makers, researchers, to address an evidence bottleneck of finding the right evidence in social systems. Then what do we hope in the long term PEARLS can contribute? And I think there are three key points which ideally over the period of the project we could work towards. The first one is really about building a strong global network and community of practice of EIPM organizations, with then we can embed our own work here in South Africa within. So it is to be part of a larger group of evidence champions and EIPM organizations that work on the forefront of evidence use in social systems, and to learn from what has worked in different contexts so that we can broaden our portfolio of EIPM tools here in South Africa, which then in return ideally gives us some form of reference point where to look for support and advice, and also inspiration around evidence use, because you sometimes can feel a bit isolated doing this type of work, particularly in the social systems side. So we're hoping for this type of embedding in a wider community of practice. The second long-term change that would be ideally emerge is around the institutionalization of governance structures to foster the use of evidence. So I've mentioned that we already have quite a good institutional infrastructure from a government perspective, but there's quite a bit that we can iterate and experiment on, in particular around co-production or co-creation as a value within the methods of producing rapid syntheses and rapid responses. So we're very excited to look into the citizen dialogues, the stakeholder engagement in a much more systematic and embedded way, not an ad hoc, once-off, opportunistic way. And we hope to see lots of learnings that can then be institutionalized. Which links to the second point here. around that there is quite a bit of technical skills for EIPM already existing, in particular at a government change, but not so much maybe on a soft skills side, on a skills side for co-production, sharing values. And we know there's partners in Pearls who have massive experience on building the soft skills side of EIPM. And bringing this to South Africa should be of quite a bit of benefit. And then the last point we would hope to see is to enhance the long-term profile of EIPM within the country, to broaden the pool of new evidence champions, both on the supply and on the demand side, and to make a firm case to anchor EIPM outside the health system, not just within the kind of current usual suspects, which by extension would also ideally help us to move across silos of methods and sectors within EIPM. So you have impact evaluation organizations in South Africa doing their thing. You have evidence synthesis organizations doing their own type of portfolio of work. And so to bring these type of actors together so that we work less in silos and that we work more towards a systems and rapid learning approach. I hope that gives a bit of an overview of the short-term and long-term changes we hope to see and how Pearls fits in South Africa in our institutional environment for EIPM.
That was great. Thanks a lot, Laurenz. Marie-Gloriose, if you want to share a few thoughts, and then following that, we'll move on to our Q&A.
Perfect, thanks. Let me try to be very brief. I know we don't have a lot of time left for questions. Yes, first of all, good afternoon and good evening, and thanks for the invitation. Of course, IDRC is very pleased and very excited to be supporting this innovative initiative. I think you've heard from John the innovation of the approach, the content, as well as really the complexity of the issue. So we're really excited to be part of the initiative and be able to support it. He mentioned the fact that the project has just been approved and we're looking now forward to the successful implementation of it. So before I share maybe my couple of observations or thoughts, let me very quickly just for those who may not be familiar with IDRC, tell you what it is about. So we are part of the Canada's International Assistant Family, and established in 1970. Really, the IDRC focus is to fund research for development, and we do this by providing support to emerging and established leaders. And those are in different countries with a focus, of course, on low and middle income countries. And in this case, with a great collaboration with also institutions in Canada and UK. And the idea here is to make sure that they can generate relevant evidence and also contribute to informing, developing, and implementing effective policies and programs. So with that in mind, it's very now clear why IDRC is very interested and provides great support for this initiative, because it definitely fits very well with our mandate, but also addressing clear needs that we see in terms of addressing developmental issues using effective and relevant evidence. Just a couple of probably things I would like to raise here. The first will be to say that we do expect, I was saying in my quick introduction, to see this project as really one that will provide strong evidence using the implementation research approach on looking at what works, where and when, and that evidence be useful globally to be able to not only scale up the approaches, but also to have a greater impact. So we're looking at these as a great, well, in a sense, kind of a pilot approach on some of those promising mechanisms that worked in health, and expand to other sectors as well. And these will also impact not only the processes, but also the content of what should be addressed now going outside of the health sector. So we're looking at as a very innovative approach and very grounded in a way that countries are trying to address all developmental issues, and in particular the Sustainable Development Goals. My second point will touch on the collaboration and partnership. I think listening to the design that John was sharing, as well as the expectations from Cristián and from Laurenz from Chile and South Africa, it is clear that this project is also going to contribute to ways of doing things in effective manners. And this means looking beyond one sector. Cristián was talking about multisectoral and multidisciplinary approaches and action. There is also the same in South Africa, and also building the community of practice. This is something that most of other initiatives are sometimes not addressing or having difficulty to do. So this is another area where really great learning should be garnered and used. This collaboration and partnership is also critical at the international level. John again talked about how not only the research teams and their support teams will work together, but these will go beyond, and that's what we expect as well. And in terms of funding, seeing this as a partnership between Hewlett Foundation and IDRC is something that also perspective of IDRC is very critical. Having like-minded organization coming together to support such initiative, be able to expand not only the reach in terms of number of partners and countries, but also the approaches that can be used and tested to improve evidence-informed policy making and practices. So just to end, I think there is a lot that will be shared, that will be learned. Both the country representative from Chile and South Africa mentioned that. John also did. Just the perspective of funders, I think there is a lot for us that we will learn from this project, because it will help us to understand how best also to support these kind of initiatives. And just standing alone as an evidence-informed decision-making related project, because most of the time for research for development, what is usually often seen is that evidence-informed approaches, informed policymaking approaches are embedded in the research project, which is really great, with an assumption that the teams that are conducting research are also able to understand and identify effective ways to do to inform policymaking. But it is also equally critical to understand the mechanisms to do that as just a research project in itself. And that's where this learning will be very critical for, believe, IDRC, but also Hewlett Foundation. And we're hoping that as many of the funders are struggling to see how this can be better done, then they will generate a lot of interest and support moving forward in this area. So I will stop here, and looking forward to the discussion.
Thanks very much, Marie-Gloriose. That was great. So just before we get into our Q&A, I would just encourage people to use the chat box in the bottom right-hand corner of your screen to ask any questions. With that being said, we do have a couple already, so we'll just jump right in. And I'm not sure who is best to answer this, but it's sort of a multiple part question. With regard to the evidence review, what methodology is being used? JBI, Cochrane, or other? And then the second part is whether the evidence generated is being stored and freely shared between countries and regions.
So Steve, maybe this is John, maybe I'll jump in, and then Laurenz and Cristián can jump in as well. On the first question, these evidence syntheses are not systematic reviews. So they would share with systematic reviews a commitment to be systematic and transparent in identifying the evidence, in selecting it, in assessing it where appropriate, and in synthesizing it. But they are not asking the type of very specific question that a traditional systematic review does. And they, so some ways that they're different are that they're context specific. So they're meant to say what evidence would be relevant to this in a particular context, this particular issue. Second, they're very often working through a problem and its causes, options for addressing it, and implementation considerations. So they would draw on single local studies, perhaps to understand the problem. They would draw on perhaps 5, 10 systematic reviews to understand what's known about the options, as well as economic evaluations and so on. So they share some similarities at a very high level, but these types of products are very unique, both the rapid syntheses and the evidence briefs and the citizen briefs. When it comes to the second question about sharing, and this is where I'm particularly keen to hear from Laurenz and Cristián, but they should also feel free to weigh in on the first question. I guess I think of it at 3 levels. One is the global evidence that we're sharing through the email alert, social systems evidence. That's a freely available database that anybody can access. In terms of the rapid syntheses, the evidence briefs and the citizen briefs, the dialogue summaries and the panel summaries that will be produced by the partners, those would typically all enter the public domain. This is where I'm curious to hear Laurenz and Cristián's reaction. In Canada and in some other countries where we've worked, there are times where we embargo a product because in the first 3 to 6 months after it's completed, a government may not want a wide variety of stakeholders to know that it has asked a question on a particular issue because they are actively thinking it through. So we, at least as one of the 14 partners, are very comfortable with delaying the entry of a product into the public domain, but we are committed to make sure that every product eventually enters the public domain. I'd be curious whether Cristián and Laurenz have the same reaction. Then in terms of the 5 lessons learned reports, those will initially be available only to the partners behind a security wall because those are going to be frank reflections over time. Eventually, they will be put into a form that is available for sharing beyond the partners. But in the early days of the project, they're meant to be behind closed doors, capturing of some of the lessons learned. So can I turn it over to Laurenz and Cristián? Maybe Laurenz, do you want to go first? Anything to add and any reactions specifically to that point about whether some products may be delayed or may never enter the public domain?
Yeah, super, thanks. So I think just quickly on the first one, to say that probably we're really excited about playing around with different methodologies, because I think our experience has been that most requests require slight adaptations. So learning around different synthesis methods for rapid responses and reviews, we're quite excited about that. Yeah, the second one is tricky. So our experience has been that it depends on the level of seniority. So within the requests that we've gotten that come from sometimes the general or even ministerial level, that those have not been published. So neither, in fact, the request that we then produced rapid response or rapid review has been published. For the responses that we've gotten from less senior levels, those have been made open access and published on our websites and the departmental website. I'm quite curious to see how it will develop once we move kind of outside the departments we work with currently, because I think the context in which in particular DPME, the National Coordinating Department, works is that they get quite, they sit within the presidency, so they get quite high-level requests, fairly politically sensitive requests. And my feeling would be that if we move out of that environment, that we might get less sensitive topics. But I think just how we would approach it is, I think we definitely open to keep these reports initially confidential, with the ideal being that eventually they are being published. But we do understand that departments might feel, at least for a couple of months, that this should be behind, behind paywalls or behind, out of the public realm.
Yeah, it's my turn, right?
Yep, go ahead, Cristián.
Yeah, just a little quiet again, Cristián, if you could speak up.
Oh, sorry. Yeah, sorry about that again. Just to complement the first question, I agree with Laurenz with that we are very kind of open to see the methodology that we'll use for answer that. We haven't had like a right discussion with the partners on that, but I think and probably John would agree with that we are thinking of something that could be rapid, and that means that we will use systematic reviews to inform the answer for that. And for the second question, I just would like to add that, well, it's also a kind of like political sensitive issue, especially for the questions, right? So not necessarily the answer that we'll provide, but it could be political sensitive that the government or any policymaker is kind of having a question related to some issue. In that sense, in our experience, at least from the very beginning, we didn't have all our rapid evidence synthesis published. We do have it now, but then they need to be like sometime not publicly available, and after some time they will be published and released to the public. Also, there's some issue with this second question that because they are mainly directed to policymaker, to local policymaker, they are, in our case, produced in Spanish. Well, we will probably adaptate that for this project, but then our version, for example, is publicly available, is in Spanish, which could be also a barrier to make it freely available to many countries and regions, right? So this is just to add.
And Cristián, I think you also talked about the possibility that among the Spanish-speaking partners, so yourself and our colleagues in Colombia and Brazil, that's Portuguese-speaking, but the three of you, because sometimes you're dealing with similar issues, Brazilians are often comfortable in Spanish, and vice versa, you might be more comfortable in Portuguese, that you would try to explicitly share what rapid syntheses you're producing, because it could be one of the other partners, it would be faced with a similar issue and could very rapidly contextualize it to their country and get it out separately. Did I understand that right?
Yeah, you're right, John. So we're just thinking that because we are geographically close, we could kind of have the same kind of issues, like political issues. So then when we are identifying the window of opportunity, we'll try to use kind of common issues that will have the three countries. And with that, each country will produce a rapid evidence synthesis that will try to make common efforts to join different citizen panels or different stakeholder dialogues using the same rapid evidence synthesis from one country to another. So that's the idea. That's the concept, that we'll have the same or similar issues, policy issues to address. So we'll see how it will be, but it's an exciting idea, I think.
Great, thanks, Laurenz and Cristián. I don't want to speak out of turn, but I think the other part of this too is not only in terms of sharing the evidence and knowledge that you gather, but I think that an exciting part about the Pearls Network is the opportunity for all the groups to learn from each other as they navigate some of these different scenarios in terms of how to proceed and how to best present evidence as well. Is that right, John?
Yes, absolutely. I'm writing notes down about these issues because these are exactly the types of things that we want to capture and over time have explicit discussions about and have ways of addressing the challenges as they arise. It's 14 teams that each have incredibly rich experiences and are comprised of incredibly thoughtful folks. And so every time these types of issues come up, I think we can rapidly talk through an array of ways of dealing with things, document it, and then, in the coming years, be sharing those lessons learned with other people. And because we're working across so many different contexts and will be working across so many different issues, there's just going to be a lot of richness in the variety of responses that people have identified as challenges have emerged. As you're absolutely right, Steve, that's a very explicit intention of this, and we are building in these processes to make sure we capture and document this and then eventually share it with others.
Great. Well, thanks very much, John, and all of our presenters today. It's been a really very interesting webinar, and sounds like a really fantastic new initiative, and looking forward to hearing more about it as things move forwards and as it gets more developed. But thanks again to all our presenters and everybody who attended today, and we look forward to having you join our top 10 webinars again in the future.
Thank you. And I would like to take these quick opportunities, Marie-Gloriose here, to thank the Health Forum for its leadership in this area and the coordination role they really strongly played in bringing this initiative together. So thank you for everyone.
Great. Thanks. Thanks very much, everybody. Bye.